I'm Hallie Wooten. I'm going to be doing the injection sites video today, and here's my badge. And so now I'm just going to scan the room. Alright, so the first site I'm going to be showing you is the deltoid site, which is used for intramuscular injections. So I'm going to have the patient move their arm so I can find the acromion process. Alright, and so it's right here. So I just want to make sure that I'm 3 finger breaths below, and I'm also going to find the deltoid insertion. So right here. And the site for injection is, I'm going to make a V right here, and that is where the injection would go. I just want to make sure that I'm not anywhere below the deltoid insertion or above the 3 finger breaths of the acromion process. And I would be giving the injection at a 90-degree angle. So next I'm going to move on to the dorsolateral aspect of the arm, which is more towards the back of the arm. So I'm going to be below the deltoid insertion of the arm and more towards the lateral side, so towards the back, and 3 finger breaths above the olecranon process. So this rectangle right here, this area, I would be able to give subcutaneous injections. So either at a 45 or 90-degree angle, depending on the amount of subcutaneous tissue I have or the size of the needle. And so now I'm going to move on to the vastus lateralis. So I would be moving my patient's leg to feel the greater trochanter, and I can feel it right here. And I would want to make sure I'm a hand's breadth below and a hand's breadth above the knee. And I also want to make sure that I'm not going past the midline of the leg and the midline of the side of the leg. So midline of the top and midline of the side. And so this whole rectangle would be considered my vastus lateralis. And typically I would use just the 1/3 middle part to give my injection, but all of it can be used, and it is a intramuscular or subcutaneous injection site. So intramuscular would be 90 degrees and subcutaneous would either be 45 or 90 degrees depending on the needle size and the amount of subcutaneous tissue that we have. So now we're going to move on to the abdomen and the ventrogluteal. So I'm just going to set this up. Alright, so for the abdomen, I'm going to be going around this 2-inch area around the umbilicus. So making sure to not go above the costal margin or below the pubic region, and also making sure to not go past the anterior superior iliac crest or anterior superior iliac spine. And so now we would have this whole U area to be giving subcutaneous injections, and we would either be giving them at a 45 or a 90-degree angle. So if we can pinch 1 inch, it would be 45. Pinch 2 inches, it would be given at 90. And once again, that is a subcutaneous injection site. And so now for ventrogluteal, I'm going to have my patient turn on their side and face me. And so I would also locate the greater trochanter by moving my patient's leg. So I can feel it right here. So what I would do is I would place the heel of my hand on the greater trochanter, having my thumb point towards the groin, my pointer finger towards the anterior superior iliac spine, and have my middle finger, my second finger, fan out towards the iliac crest, and I would have this V area to give my injection. I would want to make sure to palpate for good muscle, and I could use a alcohol swab to point towards the direction of my injection site, so that I'm able to properly move my hand to be able to properly give the injection. And this would be the preferred intramuscular site, and it would be given at a 90-degree angle. All right, so that's going to conclude my injection sites video. Thank you.